Preview. Hello, and welcome to Rolling Out Health IQ. My name is Portia Monique, and today I am talking with Dr. Lynae Brayboy, who is the MD and Chief Medical Officer at CLUE, which is a trusted menstrual health resource and thought leader in femtech. Welcome to the show.
Thank you so much. I appreciate you inviting me.
Absolutely. And it's a pleasure to have you on. And I was so excited to talk to you today about health and female reproduction and endocrinology, infertility, and all of that. Those are the things that you specialize in. But I want to get started with when did you want to become a doctor? Where was it that you decided that you wanted to become a doctor, and why become a doctor?
Yeah, I mean, my mother tells me that I was 2 years old when I told her I wanted to be a doctor. But I think, yeah, that's what she says. I don't remember, I don't recall, but I spent a lot of my waking hours with my grandparents. And my grandmother was a nurse, and she was a nurse that actually got her training, did all of her education during segregation. And she was an inspiration to me because she was a nurse in many different capacities. She worked in a hospital, she worked in outpatient units, rehab, and at home, every night she would make us dinner, and invariably somebody would come and knock on the door, and they'd be asking for medical advice. They'd be asking for help. And so she was a community resource in my community in St. Petersburg, Florida. She knew everyone. And I found out after her death that she actually delivered women who couldn't afford to come to the hospital and pay for their care. So she actually was a midwife at some point in her career. And so I felt like it was sort of like me taking on my ancestral mantle, really, to go into healthcare. And on my med school application, I even wrote how my grandmother really shaped me. And I'm still so thankful for that.
Yes, grandparents are very important to our community, our upbringing, and I know I didn't necessarily realize it until my grandparents were gone, but they are a very important resource to the family.
Absolutely.
Absolutely. Now, you went into the specialty of gynecology and reproductive and endocrinology, infertility, obstetrics, all of that. Why pick that specialty?
Yeah, I think for me, I felt that women always had it the roughest, and that hasn't really changed, right? Since I was a child. We have a pay gap, we have health disparity gap when it comes to research funding. That's still the case. And so I felt that going into obstetrics and gynecology would help me serve women better. And I say often women and people with periods, just because we want to be inclusive at CLUE. We say people who menstruate may not always identify as women, and women may not always menstruate. And so I'll say that back and forth. But I think just for ease, I would like to say that women just don't get the attention that they need, I think, even in the healthcare system.
Absolutely. There's a huge disparity when it comes to not only women, but women of color, and advocating for themselves as, going to get any type of help with a doctor. But you spoke about CLUE. Tell us what CLUE is and how you became the Chief Medical Officer.
Sure. So CLUE is a period tracking application available on your smartphone. Actually, we have free period tracking capabilities, and we have about 12 million users and customers worldwide in 190 countries. It was founded in 2013 by Ida Ten, and with a simple mission in mind, and that was to empower people with periods or women to actually be in control of their health and to be able to actually focus on self-advocacy by being aware of their overall reproductive health and to be reproductively literate, which is, I think, something that is still a challenge in the United States.
And you also, well, I know we opened up with the word femtech as well. What is femtech and how does that tie into CLUE?
Yeah, so femtech is any technology that aids in the care of people with periods and people with cycles. So that could be an mHealth app such as Clue. So Clue, by medical standards, would be a mobile health app. And so it informs you about your reproductive care. So that's one form of femtech. But it could be something like accessing your healthcare provider through a telemedicine platform where you're actually having a visit like you and I are having a conversation. So it's any form of technology that aids in the care of those who identify as women.
Okay, and going back to Clue, how do I access Clue? How would I know about Clue or gain more information about it?
Right, so you can download it. Anyone can download it for free. It's available on Google or also the iOS Apple Store. So both platforms support Clue. And again, it's available in 190 countries. It's available in 15 languages. And we actually have a support team that actually provides support in 6 languages. So if you have a question, you have a concern, you can actually write to support. And if it's something that's medically related, that concern actually comes to my desk. And I can actually help guide people to the resources that they might be looking for. And we also have a website called helloclue.com, which has over 400 articles written by clinicians and scientists about reproductive health care. So if you have a question, more than likely you can Google helloclue.com and find an answer. And I think that's really important because, you know, growing up, I'm sure, Portia, you can relate, there were very few resources and many people with cycles are in the dark about what's happening and they don't really have a clue. And that's where the name comes from.
They don't have a clue. Absolutely. I like that clever playing on words. Now tell me this. So Clue is an app to help you track your menstrual cycle. Why do women need to track their cycle?
Well, there's many different health benefits, but I think primarily when we start menstruating, which is called menarche, which is around age 12, we don't really know what's happening, right? You know, your period comes, maybe you're surprised, maybe the flow is heavy, maybe it's not. You want to get a sense of what's typical for you, and you want to know your patterns. And so it takes about 2 years for your menses to actually regulate. And after 2 years, they should be fairly predictable, where they come every 20 to depends on the person. I'm not even going to say what the clinical definition is. So it depends on the person, and you not knowing when your periods are coming can be really, really devastating for a lot of young women and people with cycles, right? So tracking, I'm sorry, go on.
No, I was listening.
Yeah, so tracking is really important because it shows you what your typical patterns are, how you potentially bleed, right? And so when I say cycles, I mean from the time you bleed, from this time to the next time you bleed, that's a full cycle. Versus a period are the actual days that you actually bleed. And you want to be able to quantify how much are you bleeding, right? Because a lot of individuals who have what's called heavy menstrual bleeding or abnormal uterine bleeding don't know that they actually have it, and they can become anemic and have multiple health issues because they're anemic. So tracking helps you to know what your standard is, what your normal is.
Now I want to get into the disparities that women of color face when it comes to just basically taking care of their health. Talk about the rates of disparity that we face as Black women when it comes to going into the doctor, making sure that we're advocating for ourselves, getting the care that we should be getting.
Right. So when it comes to health disparities, if you look at any health outcome, Black women tend to do worse. And let's specifically talk about reproductive health outcomes. So first, let me back up and talk about the history, right? We have a long and sordid history with the medical community. And it starts with something as simple as we were enslaved, and so we did not have agency over our reproductive care. In fact, February 28th and March 1st actually are days that we actually commemorate Lucy, Betsy, and Anarcha, who were enslaved women who Dr. Marion Sims actually operated on without their consent. And actually, he was formerly called the father of modern gynecology, when we know that these 3 women are actually the mothers of modern gynecology. And there were other enslaved women who we don't know their names, who actually shaped what we actually have as modern gynecology today. And so I think that's important to call out. It's also important to know that because of our history, essentially people don't feel comfortable. We have a history that has essentially been, our reproductive health has not been something that we had self-agency over. And so another, and this is, if anyone is interested in reading about this, they can check out Dr. Deidre Cooper Owen's book, Medical Bondage. Also, there is another book that I'm actually reading now called Skimmed, about the Fultz quads, about how Black women have not been encouraged to breastfeed and how that has actually changed our infant mortality rates and our health outcomes. And I think it's a really important read. The story of Henrietta Lacks, I could go on and on and on. So many Black women have really never had what I think is a full trust of the medical system because of this history. And so because of that, we see that there are some really, really disparate outcomes. So when you think about the things that are markers of reproductive health, one of the things is unintended pregnancy. So in the US, we have a huge issue with unintended pregnancies. About half of our pregnancies are unintended in the US, actually. But when you look at ethnic minorities, specifically Black women, African-American women, compared to non-Hispanic white women, there's only about 33% of non-Hispanic white women who have unintended pregnancies versus like 79% in Black women. And even these numbers, are, of course, are dated because this is data that was collected before. When you think about also preterm births, Black women have higher rates of preterm births. When you think about breastfeeding initiation, which is breast is best, our rates are lower, again, because of manipulation by the Pet Milk Corporation. When you think about cervical cancer, even though Black women get pap smears at the same rate or even higher as white women, we actually die of cervical cancer at higher rates. And it's a completely preventable disease. Also, when we think about infertility, which is my specialty, Black women are 2 times more likely to experience infertility compared to white women. And why is that? Well, there's obviously this background where there's this racial bias that a lot of providers have, that unfortunately people think that Black women are hyperfertile, which is not the case. And so what happens when someone experiences infertility, which is 12 months of not being able to conceive if you're less than 35, and 6 months if you're over than 35 years of age, what happens is when they present, they often don't get referred early on to an infertility specialist, and age is everything when it comes to infertility outcomes.
You said a mouthful. Thank you for sharing all important, very important information. Now, let's talk about how women can get some help and advocate for themselves and being proactive about their sexual health.
Absolutely. So there's many things that you can do. And I think that's why at Clue, it's really important for us to get the message out that period tracking helps empower you. Not only can you track your period and when that's coming and how your period actually, in terms of the length and how the flow and the symptoms that you might have, if it's breast tenderness or bloating, all of that is really important. And why? Because it allows you to see trends. It allows you to collect data about yourself. And when you do that, you can take that data and actually use that data to self-advocate, right? And so you have that information in the palm of your hand. So you don't get turned away or you're not dismissed when you actually present to care. And so I think period tracking helps inform oneself about one's own reproductive health. And that's really empowering. So if one person says, oh, I wouldn't worry about it or relax, or I don't think that's a big deal, then you can seek a second opinion.
Yeah. I know many women, like you were saying, Black women or women of color, it's perceived that they're very fertile.
Right.
And I think the statistics that you use were 12 months without conceiving, and then under the age of 35. And then
so 35 is the marker for everything in reproduction. So under the age of 35, we give you 12 months to try to conceive. But if you're over the age of 35, then we shouldn't wait that long, because as you age, the rates of spontaneous pregnancy actually decrease and live birth.
Yeah. Now, I know some of my girlfriends are going through this now. Is there anything that they can do to help their reproductive system if they are over the age of 35? What are some of the things that they can do to help them conceive and help them keep their sexual health and reproductive systems healthy?
Right. So one of the first things you can do is really track how many cycles have you been trying to conceive. And you can actually use our Clue period tracker to determine when approximately you have timed intercourse, meaning, you can use luteinizing hormone kits, and those are things that are available from the dollar store. You can actually start tracking and find out, okay, when are these positive? I had intercourse. It's been 3 months. Okay, maybe we should make an appointment. And we're actually coming out with a feature later this year to help really guide people along that journey, which will be really important, I think, because it'll help people understand when it's time to maybe be referred for an evaluation.
And as a doctor, what is that age that that you would not necessarily what's the age that's, I don't want to say that's too old, or do you get where I'm going?
Right. Some people are really concerned. What's the magic age to become
What's the
pregnant?
magic age? Thank you.
Yeah. So there's no magic age, right? But the Centers for Disease Control and the Power to Decide have come up with a really great kind of questionnaire that you can take, and it's called the One Key Question. And it helps you to kind of pull together all of your information, all of your, health history, all of the medications that you take to really find out, when is it that you want to conceive? And having a reproductive life plan is so very important. Essentially, what it means is that you can sort of plan out your pregnancy. So if you're in your 20s, it's important to think about your reproductive life plan. How many kids do you want to have? When do you want to have them? Do you have any medical conditions that could complicate a pregnancy? And that's really important because we know that Black women are more likely to die due to an obstetric complication or pregnancy-related death. And that's actually 3 to 4 times more likely compared to white women in the US. And so it's really important to plan your pregnancy ahead of time so that you can make sure you're in the best health, because pregnancy is a stressor for your overall health, no matter how healthy you are. And so there's no magic time, but obviously over the age of 35, it gets a little harder. So trying to plan before age 35 is ideal.
Okay, so we'll go with that. Now, we did see lately in the news that Kiki Wyatt is on her 11th child. Yeah, okay. So you're in Germany. We know that you're in Germany because we talk backstage, but
Right.
it came out in the news here in the US that Kiki Wyatt, singer, R&B actress, all of that, she's on her 11th child. Some women would love to be that blessed. How does she, is that something that's just genetics that just runs in her family? Because I believe we looked up the age and she was headed towards 40. So she was 35 plus, but she's on her 11th child. So is that just something that falls in the cards for her, or is it just genetics? How can one become that blessed to have 11 born children?
11 children can be absolutely a blessing. I think there's no data that, someone is able to have this many children, not have that many children. The important thing to remember is that she's had 11 children. I don't know her, but I'm assuming because she wanted to. And that is definitely her prerogative, or it's her prerogative or anyone else's not to have any children. And that's really the foundation for a framework that was developed by Dr. Loretta Ross, who has actually appeared as a speaker on one of our podcasts. We have a podcast at Clue called Hormonal. And the foundation of the reproductive justice movement amongst Black women is to be able to choose freely if you want to have children or if you choose not to have children, to have access to contraception or to have access to fertility services, to have access to abortion or to have access to adoption. All of those things are actually in the purview of every woman, but especially the Black woman, who I think has not been encouraged to explore all of those things before. But I think if 11 is what she wants, 11 is great. I'm also excited about Rihanna's pregnancy as well with A$AP Rocky. I think that's amazing. She's 35 and that's wonderful. But, it's also something to note that in the media, sometimes we see people who are in their late 40s, their early 50s getting pregnant. That's usually not spontaneously, Not saying that it can't be, but it's usually not spontaneously. It's usually with assisted reproductive technologies. And unfortunately, right now in the US, we don't have legislation that makes sure that public insurance or that every private insurance covers infertility care. And so there is a disparity.
So let's talk about that for a bit. So we've seen lately with some celebrities, Janet Jackson was one of them. Naomi Campbell is another one, having children in their 50s. Talk about some of that assistance with the reproductive technology that people can tune into and actually ask their doctors about and advocate for.
Right. So again, it's important to have a reproductive life plan. So if you start early, before you have like the end of your reproductive lifespan. So let me just clarify that. We have a reproductive lifespan as people who menstruate. So at menarche, that's when you start your reproductive life, right? So you go through puberty, you start to ovulate, and that's something that every person who has ovaries and a uterus will invariably go through, right? Unless there are some conditions that can limit their progress through puberty. But then at the end of the reproductive lifespan, which is menopause, you stop menstruating, right? And so that's the end of the reproductive lifespan. And that varies. The average age is 51, but based on someone's medical history, someone's surgical history, exposure to toxicants, chemotherapy, that can be sooner. And what people should know is that when you get to the end of your reproductive lifespan, a lot of the times when you ovulate, the eggs that you ovulate are not high quality. And I'm actually an oocyte biologist as well. So I study oocyte quality. And what happens is you have increased risk of miscarriage. You obviously don't have the same ability to carry to term at the same rate. You have higher rates of preterm delivery, not only delivery, but preterm labor that can lead to an early delivery. You have higher rates of pregnancy-associated conditions. And sometimes you can't conceive on your own. And so you do need infertility services, which of course can draw out the whole process of becoming pregnant and can be very costly. And sometimes even with infertility services, you still can't become pregnant with your own eggs. And so sometimes you need to use what's called donated eggs. And in certain countries like Germany, it's actually illegal. But in the US, people can use donated eggs. But as you can imagine, there are not as many egg donors as there that are African American as there are egg donors that are not African American. So there are some egg banks that particularly cater to the African American community, which is great, but I think it's still important to note that there's an increased risk with donated eggs. So if you purchase eggs from an egg donor through an egg bank, and then you have those eggs fertilized with sperm and you have those embryos transferred, you can become pregnant, but those risk factors don't go away. In fact, they're intensified.
Wow, so much information, so little time. I feel like I know our audience will have tons and tons of questions for you. So I feel like you will definitely have to come back and do one of our segments called Ask a Doctor, where they can just chime in and just ask the questions that they would like to ask. But for this segment, we are running out of time. So I'm going to go ahead and let you give us the place where we can get more information and where we can follow you and or ask you questions via social media or websites as well.
Sure, you can follow us at ClueApp, that's CLUEAPP on Instagram. We're also on LinkedIn, and you can just follow us at Clue by BioWink. We also have a website at helloclue.com, and that's HELLOCLUE.com. And we have a podcast called Hormonal, which is available on Spotify or SoundCloud or wherever you listen to your podcast. And we have 2 seasons, so check us out. I'm in season 2, so would love to have you be part of our Clue community.
Absolutely. Thank you so much, Doctor, for stopping by. So much great information that you shared with us. I'm sure our audience is going to find great value in it. Dr. Brayboy, it's been a pleasure.
Thank you so much.
Hopefully talk to you soon again on Ask the Doctor segment. If not, we're definitely going to follow you and follow Clue and all of the things that you mentioned to us, even your hormonal podcast as well.
Thank you. Thanks for having me, Portia.
Thank you. Again, Portia Monique for Real Announced Health IQ. And please catch us during another episode of Health IQ. Thanks, guys.